What retinal layers are seen with October scans? Imagine having a detailed map of the inside of that shows every tiny layer of your retina. That's what optical coherence tomography scans do. They give doctors a cross-sectional view of the retina, revealing its complex structure in incredible detail. When a high-quality October scan is performed, at least 13 distinct layers can be identified, each with its own unique reflectivity pattern. These layers run from the innermost surface, facing the vitreous, to the outermost layer next to the choroid. Starting at the very front, the first layer seen is the internal limiting membrane. It's a thin, bright line that marks the boundary between the vitreous and the retina. Just beneath that is the nerve fiber layer, which contains the long axons of ganglion cells. This layer appears bright or hyperreflective on the scan. Next is the ganglion cell layer, which holds the cell bodies of these neurons. It tends to look darker or hyporeflective compared to the nerve fiber layer. Moving inward, you find the inner plexiform layer, a bright band where synapses connect bipolar cells and ganglion cells. Beneath that is the inner nuclear layer, which contains the nuclei of bipolar, horizontal, and amacrine cells. This layer appears darker or hyporeflective. Next is the outer plexiform layer, another bright band where photoreceptors connect with bipolar cells. Below that is the outer nuclear layer, which holds the nuclei of the photoreceptor cells. This layer looks darker on the scan. Further inward, there is the external limiting membrane, a thin bright line that separates the nuclei from the inner segments of the photoreceptors. The photoreceptor inner segment and outer segment junction, often called the ellipsoid zone, appears as a bright band representing the connection point between the inner and outer parts of the photoreceptors. This zone is crucial because it reflects the health of the photoreceptor cells. Next, the retinal pigment epithelium and Bruch's membrane complex appears as a highly reflective band just above the choroid. This layer supports the photoreceptors and is vital for their function. Finally, beneath the RPE, you can see the choriocapillaris and the choroid, which are vascular layers supplying blood and nutrients to the retina. These layers appear as alternating bright and dark bands because of their different cellular compositions and how they reflected light. Nuclear layers like the outer nuclear layer and inner nuclear layer are usually darker, while plexiform layers and the RPE are brighter. Recognizing these layers helps doctors diagnose and monitor conditions like glaucoma, where thinning of the nerve fiber layer occurs, or age-related macular degeneration, which affects the RPE and photoreceptors. Understanding these layers is essential because changes in their thickness or appearance can indicate early signs of disease. For example, thinning of the nerve fiber layer can signal glaucoma, while abnormalities in the RPE or photoreceptor layers can point to macular degeneration. October scans provide a detailed view that guides treatment decisions and helps track disease progression over time. Always remember, if you have concerns about your eye health, consult an eye care professional who can interpret these scans accurately and recommend the best course of action for your individual needs.